This is the anatomical position of a sternum. Broad quadrilateral upper end directed upwards. Anterior surface is convex. Anterior surface is convex and lies anteriorly and marked by three transverse ridges. Posterior surface is smooth and concave and lies posteriorly, and triangular pointed lower end directed downwards. Now we'll talk about the manubrium. The manubrium has two surfaces and four borders. The surfaces are, this is the anterior surface, this is the posterior surface, and four borders. This is the superior border, this is the inferior border, and two lateral borders. Now we'll talk about the anterior surface. The anterior surface gives attachment origin of two muscles, pectoralis major and sternocleidomastoid. Sternocleidomastoid, sternal head of sternocleidomastoid arises from the upper end on either side of the median plane. This is the attachment of sternocleidomastoid, and pectoralis major arises from each side near the lateral border. This is the attachment of pectoralis major. Now we'll talk about the posterior surface. The posterior surface also gives origin of two muscles, sternohyoid and sternothyroid. Here is the attachment of in the upper part. This is the attachment of sternohyoid, and slightly below this is the attachment of sternothyroid. Now there are some important relations in the posterior surface. The posterior surface of manubrium is divided into upper half and lower half. Lower half is related to arch of aorta and upper half is related to the branches of arch of aorta, such as brachiocephalic trunk, left common carotid, left subclavian, and brachiocephalic vein. Now we'll talk about the borders of manubrium. This is the superior border or jugular notch or suprasternal notch. The anterior and posterior margin of the notch gives attachment to investing layer of deep cervical fascia, and lower fibers of interclavicular ligament is attached here. There are two oval articular surface on either side of the suprasternal notch, and that this articulates with the sternal end of clavicle. The anterior and posterior margin gives attachment to sternoclavicular ligament, and margins gives attachment to corresponding sternoclavicular joint capsule. Now I'll talk about the inferior border. This is the inferior border of manubrium, articulates with the body of sternum and forms sternal angle or angle of Lewis. This can be palpated just below 5 cm below the suprasternal notch. There are some importance of sternal angle. These are: rib counting starts from here, ascending part of arch of aorta begins and ends at this point, and beginning of descending part of arch of aorta starts from here. Trachea bifurcates at this level, pulmonary trunk bifurcates at this level, left recurrent laryngeal nerve hook arch of aorta at this level, azygous vein drain to superior vena cava at this level, and thymus gland ends at this level. We can memorize it by a mnemonic: rat plant. Lateral border of manubrium, and the right and left lateral borders are each marked by two articular facets. These are the articular facet, and above this is the articular facet for first costal cartilage, and below this is the small demifacet, and this demifacet with the demifacet of body of sternum forms a articular facet for second costal cartilage. Now we'll talk about the body of sternum. It has two ends, two borders, and two surfaces. This is the convex. This is the convex anterior surface. This is the smooth and concave posterior surface, and these are the two lateral borders, and this is the upper end, this is the lower end. The anterior surface is flat and it is marked by three transverse ridges. The three transverse ridges represents fusion of four sternibri. There is only one muscle attached to the anterior surface, which is the pectoralis major. here there is the attachment of pectoralis major. The posterior surface is smooth and concave. In the posterior surface, in the lower end, here is the attachment of sternocostallis muscle, or which is called transversus thoracis muscle. Now there are some important relations on the posterior surface. On the right side, it is related to pleura and anterior border of right lung. Left side, in the upper half, it is related to left pleura and left lung, and in the lower left side, this is related to pericardium. It is directly related to pericardium. The upper end, this is the upper end of body of sternum, articulates with the manubrium and form manubriosternal joint. The lower end, this is the lower end, articulates with the xiphoid process and form xiphisternal joint. And there is a this is the lateral border, and on either side of the lateral borders there is a demifacet, and there are 4, and there are 4 costal facets for articulation with the 3rd to 6th costal cartilages. And at the inferior end of the body of sternum, there is a demifacet which together with the xiphoid process articulates with the 7 costal cartilage. This is the xiphoid process of sternum. It has 2 surfaces, 2 lateral borders and 2 ends. This is the anterior surface of xiphoid process, and this is the posterior surface of xiphoid process, and it has 2 ends. This is the upper end and this is the lower end, and in the lateral this border there is a demifacet which corresponds with the demifacet of body of sternum and forms articular facet for 7 costal cartilage. The anterior surface gives attachment to this gives attachment to rectus abdominis, and this is the tip of xiphoid process or lower end. In the posterior surface, this gives attachment to slips of diaphragm. Diaphragm also origins from L1, L2, L3 vertebral origin and costal part, and also from costal part. And here in the lateral side, and here from the lateral side there is a muscle transversus thoracic. In the lower end or tip of xiphoid process, this gives attachment to linea alba, which extends from tip of xiphoid process to pubic symphysis. The upper end articulates with the body of sternum and from xiphisternal joint. Now we'll talk about all the joints and its types. This is the clavicular notch, which articulates with the clavicle and form a sternoclavicular joint. This is saddle type of synovial joint, and this is the first, here articulates with the costal cartilage of first rib and forms first costochondrosternal joint, which is primary cartilaginous. This is the manubriosternal joint, manubrium with the body of sternum. This is secondary cartilaginous joint, and here with the xiphoid process the lower end of sternum forms xiphisternal joint, which is primary cartilaginous, and these are the other chondrosternal joint. These are plain variety of synovial joint. Now sternum we know is a flat bone, and the structure of flat bone is outer compact and inner spongy. The ossification of flat bone is normally intramembranous, but in case of a sternum it is intracartilaginous. Now we'll talk about the clinical anatomy of a sternum. We know that the sternum is subcutaneous and readily palpable along its entire length. It contains red bone marrow throughout its life, and because of its morphology and shallow depth in the chest, the sternum can be punctured readily in a needle biopsy procedure, which is called sternal puncture. We can see here the process of sternal puncture, by a needle, and under a local anesthetic, a white needle is inserted in the marrow cavity through the anterior surface of upper part of manubrium to avoid injury to arch of aorta. We know in the lower half of the manubrium posterior surface there is a relation of arch of aorta. So to avoid injury while sternal puncture, will do the procedure in the upper part of manubrium. And also in some congenital anomaly and disease, the sternum is abnormal. For example, funnel chest of in the funnel chest the sternum is depressed, and in the pigeon chest the sternum is projected forward like the keel of a boat.